Hello everyone. Today's topic is the sources of adverse event reporting. The adverse event is the medical occurrence where occurrence occur may or may not be due to the suspect drug. Uh, the causality defined as the relationship between suspect drug and event is called as causality. If causality is yes, then it is called as adverse drug reaction. If the causality is no, then it is called as adverse event. The sources for reporting adverse event includes spontaneous reporting, literature, study, articles, healthcare professionals, patients, relative of the patients, pharmacists, nurses, physician, doctors, or the healthcare any healthcare professionals. They report the adverse event or the clinical after the clinical trials also uh, AE is occur, then also source clinical trials is also the source of adverse event. Post marketing surveillance also this also the source of adverse event reporting. The adverse event is reported by using various reporting forms by different countries. The reporting forms of each country is different for reporting ADR. Uh, the unorganized data collection by submitting to the regulatory authority is carried out in spontaneous reporting. When the adverse event is reporting spontaneously, then check the validity or duplication of the or triage of the adverse event and the proper prevention or the action taken on it. Literature also the review articles of the already published review articles which is gives attention to the company for the adverse event. Also study is also gives attention to the company for adverse event. When the clinical trials is carried out, then also the adverse event is occur on the subject. Then also adverse event is produced. Then this adverse event uh, submitted to the regulatory authority, and when the and proper action against the ADR is or adverse event is taken. The organizing various patient camps or patient cooperation adverse event also identified, and the voluntarily or involuntarily the patient can report the adverse event. These the any adverse event produced in the patient, then the patient also selfly or the relatives of the patient report the ADR. Next one is the patient is patient is present in the or admitted in the hospital, then the nurses, pharmacists, physician, doctors also or any healthcare professionals also report the ADR of the patient to the pharma companies. So these are the sources of adverse event reporting. uh, some adverse event is reported spontaneously, or some adverse event is uh, some adverse event is so, some adverse event is carried out by organizing uh, patient camps of the disease camp of the patient, or other patient cooperative campus taken, and the adverse event related to the medicines are carried out. or in post marketing surveillance the drug show the adverse event, then also the ADR is or AE is reported. So these are the sources of ADR, adverse event reporting. Thank you.